We all know there is no cure for coronavirus infections right now. In the absence of vaccines to cure COVID 19, some hospitals are trying the convalescent plasma therapy on severely affected patients who have higher respiratory rate with lower oxygen saturation or to those who have pus in their lungs. It is a classic adaptive immunotherapy. In this therapy, the sick acquires only temporary passive immunization. It lasts mainly less than a week, that is, till the time the injected antibodies remain in the bloodstream. The therapy has the potential to lessen the severity or shorten the length of illness caused by COVID 19. The plasma of recovered patients may act like a stun gun in the bodies of those being treated, helping to slow down the replication of the virus. Then there is the organ damaged by the virus. So, by stunning the virus, at least it is not making more, so the organs can heal over time. What is plasma? Plasma from recovered patients consists of antibodies that detect the virus and can mitigate its growth. Plasma is the often forgotten component in blood. It is the liquid part of the blood, making up 55% of its overall content. When isolated on its own, blood plasma is a light yellow liquid similar to the color of straw. Along with water, plasma carries salts and enzymes. Also included are antibodies, clotting factors, and the proteins albumin and fibrinogen. The primary purpose of plasma is to transport nutrients, hormones, and proteins to the parts of the body that need it. Cells also deposit their waste products into the plasma, and the plasma in turn helps remove this waste from the body. Blood plasma also ushers the movement of all the elements of blood through the circulatory system. Once the blood is taken from the recovered patient, the plasma component containing these valuable antibodies is separated out and given via transfusion to other people who are hospitalized and suffering from the more severe symptoms of the coronavirus. When pathogens attack our body, our immune system starts working and releases proteins to fight with an infection. These proteins are known as antibodies. If the infected person produces a sufficient amount of protein, then he or she will be recovered by antibodies itself. Antibodies are produced in the body is a type of proteins that differ from the infection caused due to pathogen and antigen. After this, some blood cells start functioning as memory cells so that they can identify and defeat the same enemy if and when it again invades by quickly producing the same antibodies. Plasma therapy is not a new idea and has been used effectively in the past to treat other viral infections. It was first used in the late 1800s by German physiologist Emil von Behring for his life-saving work developing a cure for diphtheria, a bacterial infection that was particularly fatal for children. He injected children with antibodies to diphtheria taken from animals that had recovered from the disease with positive results. Plasma therapy was used again to treat patients with the Spanish flu in the 1918 outbreak, and in 1934 Dr. J. Roswell Gallagher used it to fight a measles outbreak among a group of students in Pennsylvania. The process of donating plasma is similar to that of donating blood and takes about an hour. The donors of the plasma are hooked up to a small device that removes plasma while simultaneously returning red blood cells to their bodies. In regular blood donation, donors have to wait for red blood cells to replenish between donations, but in the case of plasma, it can be donated frequently, that is, once in every 10 days. People with blood type AB are in the greatest demand for plasma donation. They make up just 2 in 50 people. Their plasma is universal. This means their plasma can be used by anyone. Anybody who has recovered from the infection, meaning 2 consecutive samples have tested negative and has completed 2 more weeks of quarantine, can donate plasma. People who have recovered can donate plasma every 7 to 10 days. So far, few patients have only received this therapy, and many of them have showed significant improvements, such as maintaining high level of the neutralizing antibodies, to disappearance of viremia, rapid improvement of clinical symptoms and paraclinical criteria, varying degrees of absorption of lung lesions, increased lymphocyte counts, drastic reduction of viral load. These results indicate that convalescent plasma therapy can serve as a promising rescue option for severe COVID-19, while the randomized trial is warranted. And so some health organizations call plasma the gift of life. If you like my channel, please subscribe.